Can we hone in on some local projects?
Sure.
LSU Med, University Health, very underfunded. Looks like LSU Med maybe $4 million left over, and some $6 million to fund partnership programs. Nothing's in place yet. We're a couple of days away from July 1st. How do lawmakers, how do you as the governor expect our med school here and University Health to survive?
Well, first of all, the medical school is going to survive, and I'm absolutely committed to that. And we are working with the folks at LSU who run the medical school and talking to them every day. Ultimately, there's about a $30 million need that they have for additional funding. And the last couple of years, they've come to the legislature seeking an additional appropriation for that amount. When we funded higher education to the degree that we did, that took care of about $7 million worth of the problem at the medical school in Shreveport. We then appropriated an additional $10 million in the second special session in order to help with that problem. And now we are working to change the business model in Shreveport so that they have the ability to go out and do things in the Shreveport market that's already been happening down in New Orleans at that medical school, so that they can generate more revenue without having the need to come to Baton Rouge every year for that additional appropriation. And we are going to be successful in stabilizing the funding stream for that hospital.
Governor, we chatted yesterday with State Representative Cedric Glover, who, well, rather than me describe to you what he said, we'll play his soundbite for you, and then if you would be kind enough to respond, please.
Sure.
On June 23rd is when the administration revealed that we now have a heretofore unrevealed funding formula. Now that we have accepted Medicaid expansion, that's going to be able to take that $4 million and miraculously transform it into $36 million.
Now, Representative Glover said that is something that he's trying to understand. That's just about a quote, and your response to that would be?
Well, there's no miracle involved at all. We've got private partner hospitals across the state of Louisiana have been paying $10 million a year to LSU for some data collection and related services. We are going to make sure that the money that's paid, by the way, we're going to cut that amount to $5 million, but because it revolves around information technology and research, largely being done at our medical schools, there is an enhanced match available from the federal government, and it could be up to a 90-10 match, where we can take that money, match it, send it back to the medical schools for further use in terms of collecting data and doing research, and we can use that to stabilize funding not just at Shreveport but at New Orleans as well. And it's certainly not miraculous. It's just taking advantage of what's available to you under the law.
Aaron's going to help me ask this the right way. We had Senator Greg Tarver on not too long ago, and he was talking about how the New Orleans Med School farms out their interns to other hospitals and into the community to raise revenue. And he said he thought that LSU could do that here. Representative Glover said that's not so easy to do, and maybe a little farther into the future than anyone cares to admit. Do you have a thought on that?
Well, I think that Senator Tarver is right, and we may not be able to get in Shreveport that in place to the degree that they do it in New Orleans, just because of the sheer number of different providers in that market in New Orleans. But to the degree that we can do it in North Louisiana, because you got to remember that hospital is operating out over in Monroe as well, that there are other providers that can contract with the medical school, use those doctors, and then reimburse the medical school for those services. And if that happens, I believe we can go a long way towards stabilizing the situation there at the medical school. And when you put the funding mechanism we just talked about with the clinical services being contracted out with these different providers, I believe we have the ability to put the medical school on a sound financial footing going forward, so they don't have to come every year looking for an additional appropriation.
Let's talk TOPS just a moment. A lot of people's heads are exploding. Is TOPS fully funded this fall?
No. The legislature only appropriated enough money to fund 70% of the program. And so it is not fully funded. It's a $300 million program, thanks in large part, by the way, to about 8 or 9 years of annual double-digit tuition increases that really ran up the cost of the program. But it is only funded at 70%, and it is not fully funded either for the fall semester or for the spring semester. It just doesn't work that way.
Let's turn to the Jimmie Davis Bridge real quick. That deal was kind of put together in the middle of all this last week. There were some accusations that votes were traded. If you agreed to do that, will we really get a new Jimmie Davis Bridge? Congressman John Fleming told us yesterday there is no federal money for this, and this will never happen.
Well, I can answer the first question, and that is no votes were traded on that. I was listening to folks who were both in the legislature but also local elected officials from Bossier and from the Caddo there in Shreveport, and trying to figure out what their preferences were as we move forward, whether we wanted to maintain an existing bridge but do so in a way that was going to actually stop its use and block traffic and have a negative impact on the businesses and property owners in that area, or whether we wanted to keep that open and then commit ourselves as the money becomes available going forward to a new bridge. And so I did have those conversations, but to suggest that there was anything improper about it, that's just not so. And look, we do have an infrastructure, a transportation infrastructure backlog. There's no doubt this is part of it. But we are committed to going forward and doing everything we can to explore funding options that'll be available to us to do not just that bridge but many other projects around the state.
John Bel Edwards, I can't thank you enough for your time. I hope after tomorrow the Revenue Estimating Conference report comes out, we can chat with you again next week.
Well, next week we can probably do that. I would ask you that we do it late next week. I'm actually going to take a couple of days off around the 4th and go and enjoy my family and celebrate our birthday as a country.
Well, you are welcome anytime. Thank you very much. We appreciate it.
Thank you.